this is Dr. Rogini. I'm excited to share about hip pain, which is very commonly found in our practice. So we find a lot of patients who come with hip issues, and they've tried so many different services, and they have done diagnostic tests, and most of the time it's negative. There is no degeneration in the hip joint, and but they still have this pain, and sometimes this hip pain can actually radiate into the groin, and they've probably even done abdominal tests and done numerous tests, and most of the time it's negative. So let me explain to you what could be causing your hip pain and what you can do about it. Okay, so first of all, your pelvis, your hip is joined to your pelvis. So your pelvis is a ring. So if you look from top down and from a cross-sectional point of view, it is a ring. So when the ring has shifted in this way, so it's kind of like this. It's not one ring, it's actually a joint. There's joints in the front and there's joints in the back, okay? So when the ring starts to shift, what will happen is it causes referral pain into different parts of the body, and hip is one of the region. And because there's muscles and nerves and all these tissues around it, when the nerve gets irritated, it can actually refer all the way down into the hip joint and then into your groin. So if the root cause is not addressed, the pelvis shift, what will happen is you can massage your glutes muscle, you can massage the hip joint, you can massage all the areas nearby soft tissues, but if you don't address the alignment, this pain will happen over and over again. So the alignment, what I mean by that, so when the alignment is stuck in one certain position, you have lack of motion into that joint. When you have lack of motion, you don't have proper nerve supply to the area. So now everything is kind of slowed down. I'm just trying to give you guys a little bit of a simple way of understanding this. I'm not going to use it like fancy ways of explaining, so you can just really see in your mind's eye how this is happening. So also you have to check the spine, because the pelvis and the spine is joined together. So if your spine is not in the right alignment, so let's say you have a scoliosis, or you have some form of a postural imbalance, your spinal misalignment can start to affect your pelvis as well. So this includes your sacrum too. So your pelvis has in the back, some people call it the tailbone, but really the tailbone is your coccyx, but your sacrum, which is in the back of your buttock area, can also be not in right alignment, which also needs to be checked, and which a chiropractor can check that for you. And the reasons why the pelvis can be misaligned, it could be multiple factors. Maybe you had a history of a trauma on your body, like you fell on your buttock, or you gave, due to childbirth, you gave birth and then your whole pelvis started to shift. It's so many, there could be so many reasons, and we don't know what the reason could be. Usually by an assessment, I can see where the misalignment is, and we start correcting that. It's a process. We slowly fine tune it, where we improve motion in that joint, and then everything starts to work better. And at the same time, your hip joint might be stuck too. So where your femur, your leg, your thigh is joining into your pelvis, might be a little bit, it's called the femoroacetabular joint, might be a little restricted in there, and we may have to loosen up that part of the joint as well. So there's maybe so many other factors involved, but get that checked and make sure you don't wait too long. The longer you wait, the body starts to compensate. One more thing I forgot to mention here is you may even have a short leg. So let's say you may have the right side shorter leg or left side, and you may not even know that you have it. So typically a chiropractor will assess that. When you lie down, we'll check which side of your leg is shorter. Sometimes both sides are even, but most of the time we always find a little bit shorter leg on one side of the body. So we start correcting that as well. So what I mean by correcting, sometimes people are born with a short leg, or you could have had an injury that kind of shortened that leg because of some form of fracture, but we can still work with that and improve that motion in that joint, and so your pelvis can shift again and start healing, and you start having less pain. So pain is just a sign something is not right. Get it checked, And obviously, if you don't know what to do, this is why I created this video. So a lot of people don't know where to go. Usually a chiropractor's office is the last place to come into. So I'm hoping this video will help you, or you may be able to share this to somebody else who needs it badly. And even if you don't have pain, get yourself checked from a chiropractor and they can definitely help you. We are located in Maple, in Vaughan, in Canada, and we do have a lot of patients coming from out of the country. We have locals out of the town, so you're more than welcome to visit our clinic. And yeah, so thank you for watching, and please subscribe to our page, and don't forget to watch other videos I talk about spirituality, about high vibration. I do talk about a lot of other things. So this video is more about pain. And thank you. We'll see you back.